Hi, so today we're going to run through Labour and Birth Class 2. And in video 1, we're going to cover signs that labour is approaching, what is a show, water's breaking, how to recognise it, and what to do. And we'll just briefly run through the different stages of labour. So your body preparing for labour. Okay, so what could be happening? Number 1, baby's head might become engaged. So basically what that means is that baby's head just drops down into the pelvis. Okay, and what you'll feel when that happens is you'll probably feel a little bit more room up here and maybe a little bit more pressure down below. And when you're at your clinic appointments, you'll notice that from about 36 weeks, as well as feeling, where baby's bum is, where baby's head is, where baby's back is, we're also feeling, okay, his head is down low now. How much of his head is in the pelvis? What way is he facing? And we'll always let you know what we're finding at each of your clinic appointments, so you're clued into this as well. Braxton Hicks contractions. So these are absolutely perfectly normal. You could be experiencing them anytime from 27, 28 weeks in some cases. And what they are is painless tightenings. So you'll probably notice that sometimes you put your hand on your bump and it feels quite soft, and other times you put your hand on your bump and it might feel quite firm to touch. So when it feels firm to touch, that's a Braxton Hicks contraction. Your womb is a giant muscle. It's made up of muscle fibres. And a Braxton Hicks, that's just those muscle fibres. They just want to give a little mini contract and retract. But once it's not in any way painful or uncomfortable, it's not doing anything to your cervix and it's absolutely normal. A show. Okay, so what is a show? So a show is a mucus plug that sits in the cervix for the duration of your pregnancy. And it looks quite like that top picture on the right there. So it's kind of jelly-like, kind of sometimes a pinkish or a very light brown colour. And its function is to protect your baby from the outside world while you're expecting. So it stops any bacteria or bugs from making their way up into your womb. If you are more than 37 weeks pregnant and your baby's been moving around as normal and you're feeling generally well and you have a show, there's absolutely no need to come to hospital. It's a completely normal physiological thing to happen. The only time we might maybe like a phone call from you if you had a show would be if you were premature. Maybe give us a buzz, let us know what's happening and we can guide you from there. Or obviously if you were concerned about baby's movements in any way, you'll pop back in. Okay, you'll pop into us. Why might we see a show? Okay, so I suppose just to explain this, if you imagine that this is your womb and here is the neck of your womb. And at the moment, your neck of the womb is thick and firm and closed, tightly closed. And that's what's keeping your pregnancy safe in your womb for the duration of your pregnancy. And usually in the run up to, so maybe the days leading up to labour and birth, your body's going to start producing labour and birth hormones. So the first hormone that your body's going to produce is a hormone called prostaglandin. And what prostaglandins do is they trigger the neck of the womb to soften and to relax. And it's when the neck of the womb softens and relaxes, for some women, the show just falls out. And that's why we see it. So if you notice a show, couple of days, or you won't know if it's before your labour starts, but if you notice a show, it's nice to know that, well, in the next couple of days, things could be starting. Some background labour hormones are doing their work. Water's breaking. Okay, so I always like to talk about water's breaking completely separate, I suppose, to the rest of labour and birth. And it's just for the simple reason that if your waters break, it doesn't matter what's happening with the contractions. The waters breaking will always bring you into hospital. So waters breaking trumps everything else in terms of you coming to hospital. When are they most likely to break? Most likely to break when you're 37 weeks or more and you're having contractions. That would be the most common time we hear about people's waters breaking. Why might they be more likely to happen at this time? Well, I suppose with contractions, again, if we imagine your womb, every time your womb contracts down and relaxes, contracts and relaxes, it squeezes down on the amniotic sac, okay? And the amniotic sac, if we were to, I suppose, compare it to something we're really familiar with, is like a water balloon, okay? So if you can imagine there was a water balloon in here and we were squeezing and relaxing, it's much more likely that that's going to pop and burst, okay? So generally will happen with contractions, but can happen at any time. When the waters do break, we always say to women, remember the acronym of COAT. Okay, so we say just remember your COAT. And what we're looking for, what that stands for is C, what colour is the water? You know, so just kind of, I suppose, be mindful just to notice the colour, okay? O, we're trying to establish, is there any odour? There shouldn't really be. If you were to notice any offensive smell from the amniotic fluid, it is important to let your midwife know. A, we're thinking about activity. Is baby moving around as he usually is? Keep an eye on the movements, because again, the midwife will ask you when you come into the hospital. And then finally, T for time. So what time do the waters break at? Usually when the waters break with contractions, you'll more than likely have like a gush of warm fluid that you'll recognise like, as your water's breaking. What colour could the water be? Usually it's some deviation of clear, okay? So clear, cloudy, pale pink, pale straw-like colour. So to give an example, like it might be kind of cloudy like this, sometimes a very, very pale pink like this, or sometimes just quite clear, okay? So that's what we would expect. Sometimes, it's more rare, but sometimes the waters can break without contractions happening. And when this happens, sometimes what we might notice is just a really subtle little trickle, okay? The key is that it's continuous, okay? So if your waters break, there's the best part of 2 litres of water here in your amniotic sac. So it's not just going to be one trickle and then that's it. It's going to be one trickle, and as you continue to walk and step, you'll notice that it's continuous and you're remembering, okay, my waters have broken and I'm going into hospital. If you're not sure, okay, we always say, if in doubt, check it out, okay? So if you're at home thinking, I didn't have a gush, I'm not sure if I have a continuous trickle, but something feels different, and maybe it's my waters, either pick up the phone and give us a buzz, or come on in and maybe ring us first, and we'll be able to guide you as to what next to do. We'll be able to help establish if it is your waters that have in fact broken. Just a quick note on meconium. So sometimes the waters can break and it can be this kind of greeny colour. Okay, so if you were to notice that could be meconium, which is a sign that your meconium is your baby's first poo, and it's quite rare that it happens, but it can happen that baby can do a little poo inside. So if the waters break and it's this distinctive green colour, or if the waters break and you're premature, so you're less than 37 weeks, there would be there would probably be 2 reasons that we would want you to come in that little bit sooner. Okay, so if the waters break and you're term, baby's moving around, the water's nice and clear, you're feeling generally well, you have time for your partner to come home and the 2 of you come in together and you're just remembering your coat, okay? If your waters break and you're premature or there's meconium in the water, there would be 2 times where you would say, ring your partner, I'm meeting you in hospital, I'm getting a lift in, and I'll see you in there. And it just means you can get in that little bit faster and we can monitor you and your baby that little bit quicker. Stages of labour. Okay, so I suppose just to run through what they are. So stage 1 is your cervix changing from being thick and firm and long and closed to thinning right out, and to reaching the point where it's 10 centimetres dilated, which is open enough for your body to move into stage 2. So stage 2 is that the cervix is now 10 centimetres dilated and baby's moving down into the birth canal and being born. And stage 3 is your placenta being born. Of these 3 stages, stage 1 would be notorious for being the longest. So stage 1, to put a timeline on it, maybe about 8 to 15 hours on your first baby. Stage 2, about an hour to an hour and a half. And stage 3, anywhere from about 15 minutes to an hour, okay? With stage 1, it's quite a long amount of time, and you might be sitting here watching this thinking, she said 8 to 15 hours, and I actually know a woman who was in labour for 2 or 3 days. So what we know about this first stage is, we know from the time that a woman's contractions are coming 1, 5, 1. So what that means is one contraction coming every 5 minutes, lasting a minute, consistently for an hour. And we know generally when a woman is having contractions like that, she's in what we call established labour. And typically, if we were to assess the neck, the womb of this woman who's having 151 contractions, it's usually about 3 centimetres dilated, so thinned out and 3 centimetres dilated. And she is usually in what we would call established labour. What we know about stage 1 is, from the time a woman is in established labour, so probably an hour or so of 151 contractions, we know that her cervix on average is going to open at about 1 centimetre an hour, okay? And we need to get to 10. So I suppose on a first baby, we can put a rough timeline on this stage 1 from the time that your contractions are coming 151. It's the time in which it takes for the contractions to coordinate and reach the point where they're 151, which is going to be a little bit different for everybody, okay? Thanks.